Hello and welcome to our presentation of maple syrup urine disease. Our patient is a 1-year-old who presents to the emergency department in an ambulance with his mother with a complaint of a possible seizure. The child does appear to be post-ictal with muscle weakness, fatigue, and drowsiness, and they have trouble wakening the child. The father arrives and tells the doctor that the child has been very tired lately and has had trouble eating the past few weeks. During intake, they weigh the child, and he only weighs 8.6 kilograms, which hasn't previously concerned the child's physician yet, as mom is also petite. Parents mention that he does appear much smaller than other children his age and hasn't met some of his milestones. During the visit, the doctor notes a mapley smell coming from the child, which does become stronger when the father changes the child's diaper. Here we can see the CBC results for our patient. In the case of intermediate maple syrup urine disease, the CBC results would be normal. In this patient's case, the hemoglobin hematocrit and RBCs are elevated due to dehydration that we would see from the father reporting poor feeding in the past few weeks. Here we can see more evidence of dehydration in the specific gravity and the pH, as well as the trace proteins, and the patient's dark yellow and slightly cloudy urine. The key result in maple syrup urine disease is the large amount of ketones in the urine because of the body's inability to properly utilize amino acids for energy.
Looking at the chemistry results, they proved to be normal, with the exception of calcium, BUN, creatinine, and the electrolytes. These all have increased values, which would be indicative of the dehydration the patient has been experiencing. Influenced by the urine results, additional amino testing was done. The values which came back were elevated, which shows the body has issues breaking down these amino acids. These increased values are crucial in the diagnosis of maple syrup urinary disease.
Genetic testing is used to identify mutations in the patient's DNA on specific genes. It is also required for confirmation diagnosis of maple syrup urine disease. Here shows mutations on the BCK DHA and the BCK DHB genes, where amino acids were replaced, causing the patient's condition. The recessive aspect of the mutations show that one mutation was inherited from each parent. With all the laboratory data and initial screening, this patient is suffering from classic maple syrup urine disease. In conclusion, this patient will have lifelong dietary restrictions and must avoid high-protein foods due to the branched-chain amino acids that cannot be processed.